So some of the myths about wisdom teeth, patients often say to me, oh, well, will I lose my wisdom when I lose my wisdom teeth? The only reason they're called wisdom teeth is they often come out and start forming at the age about 15 or 16 and start to erupt in your 20s, which is supposedly the age of when you start to develop wisdom. There's no lack of wisdom once they're removed. They're purely embryological remnants, teeth that we don't really require any longer and often can't retain because of lack of space and inability to maintain or keep them clean. So that's one myth, that's completely incorrect. Pain associated with wisdom tooth removal, a lot of people think it's a major procedure, but for most, I'd say more than 90% of patients, it's a relatively simple and minimal procedure with minimal downtime. On average, people may take anywhere between sort of 3 to 4 days off work. I usually provide a certificate for 1 week, but not everybody requires that full week. So everybody is different. And the other myth that's often thought about with regards to wisdom teeth is that everybody has the same experience. And so they go onto YouTube, they look at people's experiences on YouTube, they listen to their friends and family and say, or listen to what their experiences are and think that they're going to have the exact same experience. But that's completely incorrect because everybody's wisdom teeth are different in some way. The degree of impaction will determine sort of the degree of bone removal required, the degree of swelling after surgery and the recovery time. If you've got relatively simple wisdom teeth, then your recovery time will be a lot faster than those that don't have simple wisdom teeth or very impacted wisdom teeth. Everyone's pain threshold is different, so their experience and need for pain relief is very different. I take a lot of time to explain what sort of pain relief and how to take pain relief is required after surgery. So if we keep regular pain relief up, often people then don't need to suddenly take strong painkillers because they've kept a good level of pain control after surgery. Another myth, people think that if they lose their wisdom teeth, their cheeks will collapse or their facial appearances will change. Being teeth that are so far back in the mouth, it's very unusual for you to get facial changes because they really aren't important in tissue support. Really, as said, their wisdom teeth are extra teeth that are not overly functional in most cases and really are just plaque traps. And therefore, we often recommend preventive removal of them before they become symptomatic. A lot of people think wisdom teeth should be removed only when symptoms occur or if they're having pain or infection. But as I said, by doing it early and preventing plaque trapping around that area, you can potentially prevent decay and ultimately more expensive and unnecessary procedures on teeth that are more important forward of where the wisdom teeth are.